So real quickly, I'm going to pivot to what are disruptors and why is it important? It's very important for us to disrupt our own businesses. And what does that mean? That means creating a stair step in value, either to the clinician and caregiver or to the patient. And why that is important is because if we don't do it, somebody else will. And they will dictate terms to us in the future. And how I know this is that even the best companies on the internet have been disrupted. So one of the examples I always kind of throw out there is even Amazon has been disrupted. You used to search for a book on Amazon.com. Now you search for a book on Google. And Jeff Bezos dies a little every single month that he writes that huge check to Google for that right to get that traffic. And so if we're going to be disruptive, what does that mean in terms of changing how we operate? You know, how are disruptors different? And the first thing is that disruptors think differently in terms of what's the goal, okay? So the goal is not to achieve 30 billion in sales. The goal is not to hit some sort of commercial target. The goal is visionary. So its growth is a visionary agenda. And so to give you an example, the one I always kind of talk about is SpaceX. So Elon Musk wants to do what? Go to Mars, right? So we can have a discussion about whether or not that's a realistic goal or whatever, but it's what inspires people in that organization. Second is that there's a real big focus on talent acquisition and development. And the third is they build things differently. So they do it in a very rapid, iterative way instead of long projects that have a lot of risk attached to them. They also build products to evolve quickly. So consumers are no longer satisfied with a product that stays the same the entire time that they own it. So again, take the Tesla. The Tesla, if you bought a Tesla 2 years ago, it is a different car today than it was 2 years ago. Your battery life is longer. And it's because they update it every 2 weeks with new software. And then lastly, they build platforms upon which others can collaborate. And so what really makes me excited about our opportunity to be disruptive as a healthcare system is we have a lot of these traits already. So we have a visionary agenda to serve the poor and vulnerable, to create healthier communities. So we've got that. Check, right? We also have exceptional people, so kind of look around. So amazing people who are bought into that visionary agenda. Those are actually the two hardest things to get right as an entrepreneur. And we're a 150-plus-year-old organization, and it's ingrained in our culture. And then the last thing is the platform. As an organization, it is in our DNA to be collaborative. We've done that from the beginning, to work with others. And that's incredibly important to be a disruptor. If we don't do it, somebody else will. So you can see here that in every part of the value chain, there are disruptors entering in our markets. So on patients, there's Zoom Care up in Portland and Seattle. They're delivering really great customer experiences that are kind of easy and simple. There's Pager, which is delivering home visits. On the other hand, there's ZocDoc, which is creating a closer relationship with clinicians by referring to them patients. So these are disruptors in our marketplace. Oscar, which is changing the way health insurance is done, much more customer friendly. And even the government is disrupting healthcare by creating exchanges and encouraging, or at least allowing small employers a way of kind of pushing their employees into the exchanges.